My name is Kini Snow. I met Dr. Singh back in February of 2012, which was a day marked forever in my memory. It was February 9th. Before I had met Dr. Singh, I had been having a lot of pains up high on my rib cage. And at the time, my mom had just passed away, so I really thought I had given myself an ulcer worrying. And the pain just kept getting gradually worse and worse and worse. And I had called every gastric, I'm from Mount Airy, and I had called every gastric doctor in Winston, Mount Airy, and Elkin to try to get an appointment. And they all said it would be 6 to 8 weeks before they could even see me. So I called my doctor at home, Jenny, and said, you know, Jenny, I'm hurting bad, and it's scaring me. And I said, it's hurting all the way through to my back. And she said, well, you know, come, you know, right now. So I went to see Jenny. And when I told her it was hurting all the way through to my back, she said, that scared her. So she sent me right over for an ultrasound. And my insurance company had said they had to do an ultrasound first. They wouldn't let her do a CT scan. So she sent me immediately over to the hospital to get an ultrasound, and said she would call me, you know, there to wait there at the imaging center in Mount Airy, and that she would call me. So I sat there in the waiting room, of course, you know, like every person does, and I don't recommend. I Googled spots on your pancreas. It's not good. I don't recommend doing that because there's nothing good written about a spot on your pancreas. But sure enough, Jenny, she called me and said, you know, it's something we have to get checked out immediately. And that was Friday, February 9th. And I went to church on Sunday and told, you know, everybody what it was, and that I really needed people to pray for me because, you know, something on your pancreas is not normally good. And after church, a friend of mine from church had Dr. Singh's business card and came running up, and he said, I don't know why I have this card in my wallet, but it says pancreatic specialist. And, you know, he had seen Dr. Singh back when he'd had a surgery, and he still had that business card in his wallet. And it was just ironic, you know, that he had that card in his wallet the day I needed it. So my plans were to go back to Jenny on Monday morning, and she was going to try to find me somebody to go see. And so when I went back to Jenny that morning, you know, I had already told her, you know, that we'd already called every gastric doctor in the area, and nobody could see me for 6 to 8 weeks. And she was going to start calling around to make me an appointment, you know, with somebody, a surgeon. And I said, oh, I've got Dr. Singh's business card here. I want to call him. And she said, well, you know, he's a specialist, so he will probably be even longer than 6 to 8 weeks. But she said, I'll go call anyway. She went and called Dr. Singh's office, and he said, come to Winston immediately. And it blew Jenny away too, that he wanted to see me so soon, that he was able to see me so soon. And so I left Mount Airy and I came to Winston to see Dr. Singh. And it turned out, you know, within 3 days of finding out I had something on my pancreas, I was in with the only surgeon that could have done what it was needed to save my life. We came to Winston immediately, and I brought my scans from the hospital there. Dr. Singh wanted to see his, you know, own scans. He wanted to perform his own scans, so he sent me over to the imaging center. And the guy in the imaging center also said, you know, probably be 4 or 5 days. It may be the first of next week before you hear anything. And we had left Winston and gotten back to Pilot Mountain, which is only about 30 minutes away. And my cell phone rang, and it was Dr. Singh. So we pulled off the side of the road, and he said, I've got good news and I've got bad news. He said, the bad news is it is cancer. He said, but the good news is I feel I can get it. And I held on to those, I feel I can get it, those 5 words. I held on to those, I feel I can get it, for the next 6 months. That's honestly what got me through, because after Googling, pancreatic cancer, they just don't give you much hope. There's just not much hope. And you don't read anything positive online. Everything written online is from people who are devastated and in despair. And there was just nothing good to hang on to give me that little ray of hope. But when he said, the bad news is it's cancer, but the good news is I can get it. And that's really all I needed I just needed that one little ounce of hope, that just tiny little bit of shred that maybe I could live through this. And I really held on to that. I held on to that hope. So we came back February 14th, Valentine's Day. We were sitting in Dr. Singh's office, and he was showing us the scan, and I thought, that's not quite the Valentine's Day I had in mind, but he showed us the scan and showed us how, where it was located, and it was in a very, very tricky spot. Just the confidence coming out of Dr. Singh was just, it was just what I had to have. I had to have. I remember I even said, are you going to give me a miracle? And he said, I don't give miracles, only God can give miracles. And he said, but I'll do what I do. And from that minute on, I thought, yep, he's the guy that can do this. And I know I asked the same questions over and over 1,000,000 times, but he never seemed frustrated, never seemed like I was just a number to him, just a patient. I was a real person, and he knew my children's names, and he knew about my family, and no matter what I needed to ask, and how many times I would ask the same exact question over and over and over again, because I know I did. He just absolutely let me talk and let me ask my questions and comforted me, and no matter how silly my questions were, he made me feel confident. But we went through some pretty intense chemo first, trying to shrink my tumor back to give him good margins to cut. So it was very intense chemo. I know I asked my husband at the time 1,000,000 times, tell me again, what did Dr. Singh say? And I made him repeat that sentence. It is cancer, but I can get it. I made him repeat that sentence, I know, 500 times between February and April. And that's all I would need, is that assurance that he felt he could get it. And that would calm me back down. But we did the surgery. I had the Whipple surgery on April 9th or 10th. I'm not sure, but it was Easter weekend in February, in 2012. It was Easter weekend. And the confidence he had in himself, and it just reassured me to where, we pull in the hospital that morning, and you go through the whole emotion of, this may be the last 30 minutes of my life. But from the time we walked in, and he met me in the pre-op, and we discussed everything, and he discussed everything with my family, I relaxed. I relaxed, and I just really felt like that if anybody on this planet could bring me through that, it would be Dr. Singh. And he did. He did. He brought me through it, and my scar was just absolutely perfect. I had no pain. I had no pain from my surgery, from the incision site, and everything healed just beautifully. My scar is, my daughter used to pick, because everywhere I'd go, I would pull up my shirt and show people my scar, because it was just amazing how perfect it is. It's just perfect. And people, still today want to see it, because to have such a major surgery, my scar is just, it's almost non-existent. But everything, to this day, I read, I'm on the Whipple Warrior chat room, and I read such horror stories of people with such digestive issues, and a year later not able to eat. And I've seen pictures of scars that just made me shudder. I couldn't believe the difference in it's patients from all over the world. I can't believe the difference in the way they have healed and their digestive issues in me. It's like I'm I'm fine. I'm back to normal. I'm fine. You know, I do eat very healthy, but I've had no digestive issues. I've had no issues from the scar. Everything has just been just amazing, amazing. And I think back now, you know, had I not had Dr. Singh's business card and had he not been the one, I very likely, well, I know I would not be here today. I know I would not be here today if it weren't for Dr. Singh and his abilities. And just the hope I had. Hope helps you a lot. Your mental attitude helps you a lot with any kind of cancer or surgery. And I had so much faith in him that it gave me the hope I needed to be able to tackle this and go on. And I turned 50 a few weeks ago. And normally I would never tell people my age, but you know, the odds were I would have not seen 50. I don't think I would have seen 48 if it had not been for Dr. Singh. And so I turned 50, and I have a 22-year-old son and a 13-year-old daughter, and you know, those ages, they're not very vocal about their love for their mom, even though they do. You know, that's just, they just don't express it. But on my birthday, I had these two bracelets that my children, they went at separate times, and it was ironic that they both bought me bracelets. The one my daughter bought me says "Fearless," and the one my son bought me says, "I'm so glad you're here. It makes me realize how beautiful my world is." And they don't express things verbally, but when they both got me those bracelets, I thought, you know, how close I came to not being here. And I really, if it weren't for Dr. Singh, I wouldn't be here for my children. I wouldn't be able to see my children grow up and get married and have kids of their own. And I know that. I know that with all my heart. And so I just can't say enough about his ability and his bedside manner and his confidence and his willingness to let me ask the same questions over and over 1,000 times, however many times it needed to reassure me. He never felt like I was just a number or I was just, you know, a statistic. It always, from day one, it felt like we were family. We were family, and he was going to take care of me like he would his own family. And I absolutely cannot thank him enough. My children cannot thank him enough for giving me my life. Thank you, Dr. Singh.